Bournemouth University package is an online resource that is specifically focusing on infant feeding and maternal and childhood obesity. The resource package first came when a hospital trust actually approached us and said to us, we need to train our staff up to UNICEF Baby Friendly Initiative standards, but we can't release our staff, so they wanted a flexible learning package to train their staff. So we actually developed that for infant feeding, and particularly around breastfeeding and supporting breastfeeding mothers. We've now adapted it and moved it on and developed it so that it can be used by any hospital trust, any community trust that are looking towards improving their support for breastfeeding mothers. The infant feeding resource package is divided into 13 topics, and it covers all the curriculum that you would need to get to baby friendly initiative status, and it includes things like health benefits of breastfeeding, the context of infant feeding in the UK, attachment and positioning, so how to teach mothers how to position and attach their babies to the breast. It talks through how to teach mums how to hand express, so real practical skills, and it has all sorts of video clips to show midwives and healthcare assistants how to actually teach mothers. Mothers will benefit from extra support.
Maternal and Childhood Obesity Package has been nicknamed as MACO. It's a standalone distance learning package. Anyone that's involved in the healthcare of women and children should study the content of MACO. Obesity is now at epidemic levels in the developed world, and we needed to have a way of being able to resolve the problem before people were coming into hospital with secondary complications associated with obesity. MACO consists of 9 topics altogether, looking at the physiological implications of obesity, the psychological implications of obesity, perinatal and childhood obesity, looking at different tools used to assess weight. There's a whole resource section where the students can then take those tools outside of MACO and use them with real life people.
The package enables those coordinators of the training to actually observe how the students are doing or how the learners are doing, so they can actually access their grades and their marks and their engagement with the package, so that if there's any particular learners who are struggling with a topic, they can actually identify that quite quickly and offer extra support, so maybe one-to-one support if that's needed. It's good for the students because it enables them to do it at their own pace, and some will like to do it in big chunks and others will like to do it in small bite-sized pieces. But it's also good for the organisations because they haven't got to release their staff all in one go, which is actually much more cost effective. The resource package is really important because the training can be done by a large amount of people, and it will encourage and ensure that consistent evidence-based care is provided across the area.